Hello and welcome back to your online lecture on the Code of Ethics and Occupational Therapy. I am Hannah Kleppinger and I will be facilitating the second portion of your class today. Let's get started and I will share my screen. All right, you should have just completed a discussion post about the critical thinking scenarios that we have posted. There were 3 of them. If you have not made the discussion post yet, please just pause this video and go and do so now. We're about to discuss the answers, so if you haven't done it yet, just pause it and come right back. Here we go. Scenario 1. This involves justice and non-maleficence. So what we want to look at here, there's some keywords. So the commission, that's a big one. As you could see in this scenario, the occupational therapist became more motivated to make recommendations for KT tape once he started to get a commission off the sale. So this can be a conflict of interest. He was maybe choosing what he was going to do based on his financial gain, not what was necessarily best for the client. Then we look at the fact that he was not recommending it to everyone. If there was this client who had Medicaid, he maybe wasn't going to recommend it because he thought they were too poor. This goes against justice. He is not treating everyone fairly. He's not giving everyone the same resources and benefits. And even when the client could benefit from it, he wasn't going to recommend it. So that is where justice comes into play. Scenario 2 is fidelity and autonomy. This scenario was when the occupational therapists were talking about a client in the cafeteria. They were talking about the client's name, their age, their diagnosis. This is identifiable information. If somebody who knew the client was at the hospital cafeteria as well, they may have known exactly who they were talking about. This is not protecting the client's privacy, and this is a violation of autonomy. Fidelity also comes into play because of the way they were talking about this client. They were not being respectful and they were not using discretion. This is not only inappropriate, but it is an ethical violation. Scenario 3, this involves beneficence and veracity. In this scenario, the occupational therapist was going to administer an assessment that they were not certified to complete. Beneficence involves establishing competency in the intervention that you are going to do. This includes assessments. Veracity also comes into play because it involves the way that you are displaying your qualifications and what you are competent to do. If you are acting as if you are qualified to do something you are not, that is an ethical violation of veracity. If you got all of these correct, that is awesome. If you did not, that is okay. A lot of these ethical principles are very similar and it can be difficult to distinguish between them. So hopefully this was just a way for you to gain some experience and to think about what is being violated in the different scenarios. Next, we have a pop quiz. So before you got stressed out, this should not be very difficult. It should be nothing to worry about. If you've been paying attention, this should actually be pretty easy for you to complete. We ask that you complete it without any resources, so please don't look up the answers. It's only one question, so it shouldn't take you long. Probably less than 5 minutes if you know what you're talking about. Go ahead and just hit pause on this video. Go take the quiz. The link is provided in the overview sheet that has all the resources and links. It's on the second page. So just go find the link and take the quiz, and we'll see you back here soon. All right, hopefully that quiz was not too difficult for you. Now we have another fun activity to complete. This is using Flipgrid. If you have not used Flipgrid before, you can log in just using a Google account. It is a fun way to share videos with other people. What you're going to do is use the link on the screen. It's also on the previous sheet that you used to access the pop quiz. You're going to create a video acting out an ethical violation using the ethical principle that was assigned to you. This video doesn't need to be very long, just something fun and thoughtful, creative. You should post your video And then once you've done with that, reply to one of your peers, guessing what ethical principle they were violating. Try and just spread out who you are replying to. Don't all reply to the first person. And have fun with this. It does not need to be something super extravagant. Just use people. If you have people around and want to, you can use props. Just make it fun. All right, go ahead and pause this video and make your Flipgrid. Welcome back. Hopefully that went well for you. Next, we have another activity. This is a reflective posting. So we have a link on the screen again, as you may see. You can just click on it. It is also on your resources sheet. So just get to the Google Slides, whoever you choose to, and find the personal slide that has been given for you. It has your name on it. Once you get to your slide, you can just create a quick discussion explaining why ethical principles are important in occupational therapy. This can be from a client, student, or clinician perspective. It can even be from healthcare as a whole. It doesn't have to be anything specific, just whatever you feel, whatever you're thinking. And it doesn't have to be very long. We're not looking for paragraphs, just a couple sentences showing that you put some thought into the activity. So go ahead and pause this video and then create your posting. All right, hopefully your posting went well for you, and we are back to summarize our key points. So once again, there are 6 ethical principles that guide occupational therapy. This includes beneficence, non-maleficence, autonomy, justice, veracity, and fidelity. Ethical principles are essential for protecting clients, clinicians, and the profession as a whole. Once you go into fieldwork, you will actually be evaluated on whether or not you adhere to the code of ethics. So these are very important to learn and to understand now so that you can follow what you need to in fieldwork to come. If you're not following them, you may not even pass fieldwork. So it is very important to take these seriously. Once you become an occupational therapist, you also must continue to adhere to these ethical principles in practice. If you're not following them, you may get fired, lose your license, you could have malpractice, and you could even harm or seriously injure a patient. I think we all came into occupational therapy to help people. This is a way to do it, following ethical principles. All right, we have just 2 last things for you to do before you're done. We have a post-test and a teacher survey. The post-test shouldn't take you very long, neither should the survey, probably less than 10 minutes total between the 2. Both links are on the screen and provided on that objective sheet with all the links and resources. So if you want to take the post-test, it'll be very similar to your pre-test. We just want to see and evaluate you guys as a learner and see if there's any improvement after attending our educational session. Then we have the teacher survey that is for you to evaluate us. We just would like to know what you enjoyed and maybe some constructive feedback on what you think we could do better. If you have any other questions or comments or concerns, you are free to email us. We have our emails on the sheet. You can also talk with your professor. But overall, we just want to say thank you so much for participating in our module. We hope you enjoyed it and had fun. Hopefully it wasn't too stressful, because that was not the intention, and hopefully we get to meet you all in the fall. Congratulations on getting into the program, and congratulations on almost finishing your first semester. You are so close. Keep up the good work, and hopefully we can all be together again soon. Bye.